Hey everybody, Dr. G here. I'm a licensed clinical psychologist, and today we're going to talk about the difference between mood disorders and personality disorders. Understanding personality disorders is tremendously difficult. So being able to distinguish between a mood disorder and a personality disorder takes a lot of extra knowledge that most people just don't have. So today I want to explain as best as I can the difference between the two so that you can know the difference. And if you like this kind of content, like and subscribe because I've always got new content coming out. So what is a mood disorder? A mood disorder is basically depression. In other words, when people have symptoms like fatigue, exhaustion, feelings of worthlessness, feeling down every day, low mood, feeling sad, although not always feeling sad, sometimes it's feeling numb. A mood disorder is something like major depression, dysthymic disorder, which is a low-level depression that lasts for a long time. It's problems with, as it sounds like, your mood. You have a hard time regulating your mood. So let's specifically talk about what is major depressive disorder. Now, major depressive disorder is something that I work with every single day. Lots of anxiety, lots of depression. It's very, very common. And oftentimes, it expresses itself by feeling sad, challenges with sleep, slowed thinking, feelings of worthlessness, difficulty thinking, feelings of emptiness, feelings of sadness, feeling tearful. Sometimes, as I said before, feeling numb or feeling like you can't feel anything at all, having no high highs, and feeling like that you're stuck at low lows. Everybody feels sad sometimes, but depression tends to be persistent. It can be episodic. In other words, it can have a distinct beginning, it can have an end, or it can recur. It can happen in cycles where you have multiple episodes. But the big takeaway from depression is that it impacts your day-to-day functioning. Another mood disorder is bipolar disorder. It used to be known as manic depression because basically you go between two poles, mania and depression. Oftentimes people think of bipolar as being very quick. In other words, like in the course of a day, if somebody's got really high highs and really low lows and they go back and forth a lot and they're moody and they're agitated, then that's bipolar. And it can be, but that's not typically what we think of when we think of bipolar disorder. There's really two types of bipolar disorder. There's bipolar 1 and bipolar 2. Bipolar 1 is the more severe form of bipolar disorder. And the difference between something like bipolar and major depressive disorder is mania. Mania is characterized by an elevated mood. People talk faster, act faster, they're more impulsive, they're more likely to engage in dangerous behaviors. And it tends to last from days or longer, and in some cases it can last much longer, but typically we see it as a relatively small episode, but that episode can be very destructive because being manic sometimes feels very good. And it causes people to do things like drink too much, do drugs, put themselves in harmful sexual situations. It can make people act impulsively in ways that they normally wouldn't. And the opposite end of that pole is the depressive part. And so it's not that people are exactly manic and then exactly depressed and it's very even, but we oftentimes see that there's phases of mania and then phases of the major depression that we talked about from the last disorder. And the last mood disorder we'll talk about is dysthymia. Dysthymic disorder or dysthymia lasts for a very long time. It's persistent, long-lasting depression, but it tends not to be as severe as major depression. So it's really a matter of degree. It's not feeling good every day, and that's persistent over a long time, but it's milder than what we would see in major depressive disorder. So this is just to give you a little bit of education about what the different mood disorders are. Don't want anybody diagnosing themselves, but I at least want you to know by definition what some of these things consist of. Personality disorders are a wholly different animal. When we see someone with a personality disorder as a dysfunction of the person's character rather than symptoms, we focus on the fact that they struggle with being adaptable or flexible. They have a rigid personality that tends to have one primary dysfunction, and all of their thoughts and behaviors get funneled through this dysfunction. So something like a mood disorder, where it is symptoms and feeling sad and things that you can address in that way. A personality disorder is primarily genetic. We see people are born with personality disorders. It's different than the brain chemistry issues that come along with something like major depression. It has more to do with structures in the brain. It's a little bit different in that way. But it's also very, very different how you treat it. There are certain medications that can work with certain types of personality issues, but they're fundamentally very different than major depression. And you can't have both. You can't have a personality disorder and a mood disorder. Some of the ones we're going to talk about actually are very common to have together. But having a mood disorder in no way implies that you're having a personality disorder. So, let's get into what some of these personality disorders actually are. Borderline personality, or BPD, is a diagnosis where people struggle with feeling stable. They are emotionally unstable and emotionally volatile. It causes problems in relationships. It causes problems in the ability to get by day to day. And it's on a very broad spectrum in terms of functioning. Sometimes people with BPD have suicidal thoughts, engage in suicidal sorts of behaviors. And as a personality disorder expert, just to be clear, I have explanations in much more detail. If you want to see this written down on my website at drgexplains.com, feel free to check any of this stuff out there. Now let's talk about narcissistic personality disorder, and this is one that I really specialize in. These are people that are chronically grandiose. They genuinely believe that they are better than everyone else. And they talk to people like they're below them. Oftentimes they can be harsh and abusive in relationships. And that's one thing you're going to see throughout all of these personality disorders is that relationships are very difficult. And if you're in a difficult relationship, I actually have a quiz that I'm going to put below here that you can take, and it'll give you some idea of the impact that your relationship is having on you. So back to narcissists. One of the biggest challenges for narcissists is that they lack empathy. Now, all of these personality disorders, people lack insight, but with narcissism, people distinctly lack empathy. They are not able to feel what other people feel. And that makes it so that they can use other people. It makes it so they can go for only getting their needs met, and they don't see the value in making others feel good or connecting with others. Narcissists also tend to be obsessed with appearance and money and how others see them. Antisocial personality at times can be similar to narcissistic personality disorder, but these are people that have low levels of integrity or honor. In other words, they can exploit other people and feel no remorse. Think of someone who's like a con man or someone who's extremely manipulative to the point of being abusive. Narcissists can be that way too. Antisocial personality can also be like that. But someone like a psychopath is more likely to be antisocial personality disorder. We even see people with this disorder typically engage in abusive behaviors towards others, towards animals and things like that at young ages. They tend to show very little integrity even at a young age. So this is one that can be very severe and very dangerous actually. But like I said, many of these disorders are on a spectrum. So just because somebody has antisocial personality disorder doesn't necessarily mean they're dangerous. But if someone is very dangerous, they are likely to have antisocial personality disorder, if you get what I'm saying. Obsessive compulsive personality disorder is probably the most poorly named of the bunch because most of us know OCD, obsessive compulsive disorder. That's where people struggle with having thoughts that they can't control. It's anxiety based. Obsessive compulsive personality disorder is people who have such rigid personalities. People with obsessive compulsive personality disorder, or OCPD, they're obsessed with control and organization and rigidity. These people are going to be extremely rigid and challenging to get along with, and they are certainly not going to be flexible. People with paranoid personality disorder are a little bit different. They're constantly on guard, and they're fearful that others are trying to harm them or that others are trying to exploit them, so much so that it damages their relationships, and it makes it so it's hard for them to connect with others. It's different than some of the other ones we've talked about. It's in a different cluster. Obsessive compulsive personality, paranoid personality, those are in different clusters than something like narcissistic personality, but that's a whole other video. I have videos on that too if you want to check out my channel. So all of these personality disorders we're talking about are actually quite different. That being said, there are some overlapping issues, one of them being all of them lack insight. All of them have challenges with adaptability. All of them have challenges with being flexible. And all of them are somewhat treatment resistant. These are all disorders that are going to have challenges with treatment, but they are all treatable issues. But someone has to be very motivated to want to get treatment for it and to change because it takes a long time. The difference between something like a personality disorder and a mood disorder, aside from the obvious things that are different from what I talked about, is that mood disorders, we focus on symptoms. For personality disorders, we focus on making the person more adaptable and flexible. Are there symptoms? Technically there are, but that's not really how we look at it. So yes, you can look at a list of symptoms, but it's very, very different. We look at something like a mood disorder as mental illness. In other words, if somebody has a cold, like an illness, they go to a doctor, they get treated, and they get better from it, and then it goes away. That typically, even though there's some exceptions, because bipolar doesn't really go away per se, but you can manage it differently. We really look at it with that sort of model, the idea that you can go get it treated, you treat the disorder, you manage it, and then it is better. It is a very different thing than the underlying basic foundation of someone's character and their personality, which is where the dysfunction is in a personality disorder. They cannot look inward and see all the various traits they have, and therefore they cannot adapt and change. So mood disorders and personality disorders are fundamentally incredibly different. But, as I said before, people with personality disorders can also have mood disorders. And some of them often do. People with borderline personality, for example, oftentimes have challenges with mood. So the diagnosis and treatment of these disorders. One thing that's very important to me as a therapist is that people are diagnosed accurately. Not because people need a label, because I'm not really big into labels, but you do have to know how to treat something. If someone comes in and is depressed versus someone who comes in and has a personality disorder, if I'm treating the personality disorder as though it's depression, it's not going to help. It really won't. And so the person's not going to get better. They're going to get frustrated and struggle. As a therapist, you may get frustrated because you're trying really hard and it's not doing any good. So diagnosis in this sense matters. But as far as labels go, I don't think that somebody has to think of themselves as that disorder. They just need to go to their clinician and say, hey, I've got this, so that they know how to treat it. It's as simple as that. Now, diagnosis is very difficult with personality issues. Sometimes you can have a clinician who can get a feel for it in the first session. And sometimes they can diagnose in the first session, but usually it takes a good bit longer than that to really get a feel for and be able to pin down if somebody actually has a personality disorder, because that's a very significant diagnosis. That doesn't mean that you can't identify that relatively quickly, especially if somebody comes in with an obvious list of issues that match up with borderline personality or something like that. But something like obsessive compulsive personality disorder is not going to be super obvious the second it walks into your office necessarily. Might be, but not necessarily. Depression, on the other hand, you're going to know within an hour of sitting with somebody that they're probably depressed. Like, that is not all that difficult to diagnose. But for things that are more complex, you can also go and get assessed. There are people that do full batteries of assessments. I used to do them. I don't do them anymore, but I've done thousands of those. And basically, there are questionnaires that you can take. There are different tests that you can take. There are ways to get assessed if that is important to you. Not always necessary. I think a skilled clinician can usually parse these things out, but for some people, it's very helpful. And some people like having hard data. So I take no issue with it, but everybody's a little bit different in how they approach this. As long as it's a competent clinician, you're totally fine, and you should be in good hands, as long as it's someone who's licensed, competent, and you feel comfortable with. And that's so important. I think one thing that we don't emphasize enough for people looking for a therapist is that if you don't like your therapist when you first meet them, move on, go somewhere else. There's no reason to stay with someone you don't like. Now, if you go to 5 therapists and you don't like any of them, that may be a different issue. Maybe you got unlucky, or maybe it has to do with how you're approaching therapy or how you see it. Hard to say, but just be open to the possibility that there's someone out there that can help you. And if you're struggling to find that person, to try to figure out what the common thread is, the common challenge is. But one thing I want to make sure that I impress upon you, if you have one of these issues, or you know someone who does, is there's help for all of these things. Some of them are harder to address than others, like narcissistic personality. They probably, of all the different issues I talked about, have one of the hardest shells to break through, because many of them don't want treatment. They think they're too good for it. They think they know more than the therapist does, so they tend to resist treatment, and it's very challenging. But keep in mind, any of these things can be treated with the right interventions. So I know I threw a lot of information at you today, but hopefully, if you were curious about the differences between personality disorders and mood disorders, hopefully you learned more about that today. And if you like content like this and you want to see more of it, like I said earlier, like and subscribe. Thanks for watching.